So
Let me just give you one example that I think will be really relevant to people listening. Infertility is a huge issue. As Casey mentioned, PCOS, which is the leading cause of female infertility,
Can you
25%.
explain what that is?
Yes. So very good question. So PCOS is the leading cause of female infertility. Anyone listening of childbearing age will know about this. It's an epidemic right now. It's gone up. It's multiples in the past generation.
What does it stand for?
polycystic ovarian syndrome.
So
So
I
cysts.
well,
Well-
let's get into it. So that question you just asked, I know OBGYNs from Harvard who could not answer that question. This is not an exaggeration. OBGYNs are not taught what the condition is. They're only taught what the intervention is.
Okay, so let's always start. I know nothing about medicine
Yeah.
or science, but I do know about interviews. Always start with the dumb questions first.
Good. Yeah.
If you can't answer the
Yeah.
dumb questions, I don't believe you.
So when a woman, and many women listening will have PCOS and across their OBGYN, they're put on a cascading set of interventions that are pharmaceutical.
Can you just tell me what it is?
Yeah, it's insulin resistance. It is not related to insulin resistance, which is on the spectrum of diabetes. It is insulin resistance. PCOS is a metabolic condition. Casey can speak a little bit more to it,
Yeah.
but it's fundamentally related to the scene.
What is it? Can you
Yeah.
just describe its symptoms and its
Absolutely.
effect?
So PCOS, essentially you have an ovary. That
Yeah.
ovary is making hormones. And when that ovary is stimulated by excess insulin, which is the hormone in the blood that helps us take blood sugar out of
Yes.
the blood and into the cells, insulin levels go up in the setting of metabolic dysfunction. We basically destroy our cells with our toxic food and lifestyle. The cells can no longer process sugar to energy. So the cell rejects sugar and it stays in the bloodstream. The body compensates by making more insulin to try and drive the sugar into the cell that's putting up a block because it's broken, essentially. That high insulin floats all around the body and does bad things all over the body, like drives cancer growth and also stimulates the ovary to make more testosterone. So you have women who are supposed to be making, estrogen and progesterone in very specific levels throughout the hormone cycle so that we can ovulate. And instead, insulin is driving the ovary to create testosterone, which totally disturbs the balance between all the sex hormones in the female body, and we don't ovulate. So you get these cysts that form because you've got an egg trying to basically ovulate, but instead it can't because the hormones are disrupted because of insulin, which is because of metabolic dysfunction, because of our food. And we get infertility because we're not ovulating. So
Lucky Charms leads over time. to
100%.
infertility.
Absolutely.
100%. It's our
And this condition is reversible in as
Quickly.
little as 12 weeks with dietary interventions. There is peer-reviewed studies to show this. If we get our blood sugar levels under control and our insulin levels under control, we restore the hormonal balance. And many women, all the symptoms will disappear and they'll be able to become fertile. And yet doctors do not learn. The average doctor is getting zero education in nutrition. And so they don't even see this. They reach the clomiphene, the metformin. The treatment that the OBGYNs are giving to these women is a diabetes drug. And they're not talking about blood sugar. I started a company called Levels, which consumerizes access to a device called a continuous glucose monitor. There are so many women in our community who have PCOS, whose doctors who want to understand their blood sugar so that they can naturally heal their PCOS.
Yes, and have babies.
And these are
Right.
not devices that they'll only give it to late stage type 2 diabetics, even though we know that PCOS is insulin resistance. And that if we can monitor our blood sugar with this device and get our blood sugar under better control, it can absolutely set us up to sort of naturally heal. But it's not being talked about by the OBGYNs because doctors are not trained to see this.
This is everything, right? This connects everything.
Wow.
This is the future of our species, right? This is fertility.
This topic, any woman dealing with infertility, this connects everything because the doctor doesn't know what Casey just described. Look, we talked to them. They don't know. They did not learn the physiology of why people actually get this condition. And they eat what they kill. So what do they want more than anything? They want an IVF procedure. They want an invasive surgical procedure.
IVF.
Of course.
I mean, assisted
It's a
reproductive
gold mine.
technology is skyrocketing clinics
From
all
an
over the world.
economic perspective, it's a gold mine. If that woman goes on a keto diet, which is the best reversal technique for a PCOS ever studied, 12 weeks, they are robbing that doctor, just from an economic perspective, of tens of thousands of dollars for a gruesome invasive IVF procedure, which is a great procedure. But I think we all should agree, that woman across the table would love to hear that there's a more natural way and just the correct way to reverse this condition, which, by the way,
There are big time downsides to IVF.
of
And not
course,
to
of
mention,
course,
if
it's
the
not-
woman,
it's-
if the woman doesn't heal the underlying metabolic issues,
She's
it's
gonna
going
have
to
more
portend
issues.
issues for the baby too. Like
And
not
the
healing the
mom.
root, even if you get pregnant with IVF, which is wonderful if that can happen, if you're not healing the root cause issues of the metabolic dysfunction, that's affecting the fetus and affecting the mom's future risk of disease. So by ignoring this, we're just continuing to put people on this treadmill. This is what happened to my mom. And I just want to be super
Yeah.
clear, like, the picture of doctors here is very negative. But like, again, I just want to emphasize, like, doctors are not doing this nefariously. Like, there is just
Yes.
systemic misunderstanding. And there are many doctors who are waking up and teaching themselves these types of things, but it is still very fringe and small. And
Well, their vacation houses are paid for by committing more interventions. They are
It's
highly
easy for me to
incentivized.
judge them because I don't know them.
Well-
but I just want to refer you back to your own life and the decisions you made.
Yeah.
And I think that's going to be very hard for a lot of people. And you had advantages, as you've said. On the other hand, you're the only person I've ever met who's done that. And that's pretty discouraging. That's a pretty discouraging.
there is a tribe. I will say it's happening. There is a tribe. It's coming from the bottom up. This is functional medicine. You spoke with, Mark Hyman, for instance.
Yeah.
Like, there are people, there is a movement. It's happening. And you look at what's happening in independent media. You're talking about this. Joe Rogan's talking about this. People care. People are listening and people are waking up. But
Well, it's not a boutique issue.
No.
It's
No.
the
No,
numbers. are so
Americans want to
overwhelming.
be healthy. That's the thing. Doctors are trained to think patients are non-compliant and lazy. That is not true.
People are flocking to this information.
Americans want to be healthy, but the entire system's rigged against
Okay, so that leads me